question is not what other politicians do. The question is, what will I do? I will do everything that I can to deliver on the vision that we've just outlined. What's the challenge? Ryan Doobie says we can't do it. We can't get it done. Federal law precludes us from doing it. What's my answer? That's what they said when we worked so hard to pass Dr. Dinosaur, the first insurance plan in the country that ensured that all Vermont kids had access to health insurance. We need waivers for that. We got them. That's what they told us when we wanted to use global budgeting in our Medicare budgets. We got the waivers. I've proven that I can be part of a process to get the waivers, to get things done. That's the kind of governor we need right now.
The national politicians are still sort of sorting out the whole health care bill and pieces that are falling into place. If you're elected, you're only guaranteed 2 years in the governor's office.
Right.
Can you do it in that time, even with this whole bill sort of in flux?
We can make a great beginning. There's no question that this will probably take 4 years to get everything done that we want done. I acknowledge that. But I also would mention that that's why this job interview that Vermonters are conducting is so critically important. We've only had one-term governor in the history of the great state of Vermont.
So you're not counting on any savings from this idea, this piece of your platform, to close the budget gap you face this coming year?
No.
Or the following year?
I'm not going to judge what we can get done when. I think that we're being overly pessimistic on the time frame. I understand there are challenges, and I would not bank any savings on the budget for this first year. But, you know, this is not sustainable. Spending $1 million more in our little state of over $600,000, taking $1 million a day out of the pockets of small business and hardworking Vermont families, and pretending like, hey, everything is okay. Let's just keep going with the system we have. Everything's beautiful. I just think we're delusional. We're not going to grow jobs. We're not going to get Vermonters back to work. And I want to talk about the opportunity instead of the challenge. The opportunity is that if we have a governor and a legislature and a healthcare system that works, I say that the employers in the other 49 states will ask one simple question. Since we know that healthcare cost is their biggest problem, they're going to ask this: how quickly can we get to Vermont to run our businesses and grow our companies? It's an opportunity.
At the beginning, you talked about getting a for-profit insurance company out of this equation. This insurance company is not
Right.
bearing Blue Cross or what?
I think we get hung up on the insurance, the number of insurance companies, and that isn't the biggest challenge we have. We only have 3 insurance companies left in Vermont. Let's be honest about this. Unlike other states that have dozens and dozens, sometimes hundreds of insurance providers, we have Blue Cross Blue Shield, Cigna, and MVP, pretty much. Having said that, the challenge here is to get the savings. And the savings come from the following places: the 10 to 12 cents that we spend chasing money around in the system. Extraordinarily inefficient. No one in their right minds would design a healthcare system where at least 10% of everything that you spend is executed not on making people healthier, but bill chasers looking for money. Second, designing a system where, which we're on the way to doing, where healthcare providers are reimbursed for making people healthy, not for the number of tests, not for the number of procedures that they run you through. There's huge savings in that, and we'll have healthy Vermonters. Healthcare based on healthy outcomes instead of the current system. And third, using technology to contain costs. Ensuring that we're not duplicating services, duplicating tests, because we can't keep track of what the last provider did. A healthcare card with your medical records and with your payment information, which is frankly what General Motors and Ford and the single-payer systems do. And the final thing I'll say is this: we speak about single-payer in Vermont as if it's some kind of huge mystery. What I say is this: We have single payer right now. All of our kids are in the single payer Dr. Dinosaur program. It works really well. My mom and dad are in the single payer program. My mom is, they turned 65. My dad is in the VA system because he fought in World War II. He actually is in a socialist healthcare system. Those providers work for the government. The point is, this is not a mystery of why we do this. We go to single payer plans because they reduce costs, they get rid of waste, and they deliver quality health care with choice of providers. That's the vision that we see for Vermont.
Has Brian Doobie accepted money from Big Pharma?
Sorry. Okay. I know that my running mate has, I know that the person with who I'm running against has accepted over $10,000 since he's been in public life from the pharmaceutical industry. I know that given a choice of myself or Brian, they would take Brian.
So, if all this Big Pharma money has perverted Brian Doobie's take on healthcare, why has Pat Leahy been immune to that influence?
I've been very clear. I would like to see real campaign finance reform, and I would like to see a political system where Big Pharma and the special interests don't influence public policy. This is what I can control as a gubernatorial candidate, and if I'm elected, this is what I can do as governor. Pledge that I won't take it, that they won't influence me unduly. In other words, we'll invite them to the table like anyone else, but they won't have financial influence over me, and that they'll get the job done.
What chances do you think Congress will approve your waiver? What are the odds?
You know, I've met with Senator Sanders, I've spoken with Senator Leahy and with Congressman Welch. They're really optimistic that it will be passed as a bill, go to Washington, and that we will be successful in getting the waivers. They're going to work very hard to help us do it.
50-50 shot?
I wouldn't do the odds.
Is it that good?
I'm a person who's here because of 203 voters, so I'm not going to Vegas with you. Thank you so much. Thank you.